Hello, everyone. Thank you for tuning in to McDougall's Medicine with Dr. John and Mary McDougall. I'm their daughter and your host, Heather McDougall. And tonight, just like every night, we're going to get to general questions. But first, everyone. I want to hear from you, Dr. McDougall. Dr. John and Mary McDougall. And I know you've got some latest news to go on.
Heather, we have feedback.
We have real bad feedback.
Oh, how about now? Is it okay?
From you.
Yeah.
Yeah, now it's okay.
Good. Okay.
Okay.
All right. Well, Dad, Dr. McDougall, hi. Great to see
Yes.
you. I know you have lots of studies to get through this Sunday.
No, whole stack.
I do. I actually have been having kind of an interesting couple of weeks, Heather. I've talked to two medical schools over the past couple of weeks. And in fact, I gave my series of 5 lectures. I'm in the middle of that now. I'm not going to mention the medical school, why bother? But the attendance is pretty good. The 5-part series that I put together, McDougall's Medicine, A Challenging Second Opinion, which we have for sale here. That series I'm giving to medical students, residents, and staff. And the title is Diet Therapy, 55 years of experience in diet therapy. And it's, wouldn't you rather cure disease instead of manage it? Something to that effect. Anyways, the attendance is really good. But I should have been prepared for the fact that they don't know enough about diet therapy to even ask a question.
They have any questions. It's terrible.
Yeah, really. And
they don't know what to say.
And I'm telling them what they're doing is not working. Tomorrow, I talk about diabetes to this group, and I'm going to explain to them that the drugs they're using are hurting people, and that diet will not only prevent both kinds of diabetes, but is the fundamental treatment for diabetes. I'm going to show them that tomorrow morning. It's going to be hard because I'm going to have to present it from this point of view, is that just like I have to you folks, just like I talk to you. I've been criticized a lot in the past. Dr. McDougall, why do you have to talk about the medical business? Why don't you just stick it to diet? Why don't you just talk about what you really are interested in, which is food? Well, I got to show you that what you're being offered, what you're being sold, not only doesn't work, but it hurts you. And so tomorrow we're going to talk about diabetes with the medical students and doctors at this university in Southern United States, but that's regardless. Anyway, we're going to talk about that. I'm going to explain to them, don't be offended, don't be upset with me. If you want to argue your point of view that drug management of patients with diabetes is the way to go, hey, I'll allow you 15 minutes at the end of the talk. But this is a dietary disease, and if you're going to fix it, of course, diabetes affects what is affecting in the United States. 14% of the people are frankly diabetic.
Was that all? I thought it was a lot more.
Half are pre-diabetic.
Oh.
It parallels the obesity. As people get fatter, they develop insulin resistance. They get type 2 diabetes. The more dairy they eat, the more type 1 diabetes they get. Anyway, I ran across some things, Heather, I wanted to share with you. I don't know if I'll be able to get it up or not, but I'll try. Let's see if we've got it here. Yeah. If you let me share here. I want to talk to you about, and I gave you the references. This is the beginning of the discussion on 60,000 miles of damage to blood vessels that's caused by your fork and spoon.
Oh, I've never seen this before.
Well, this is the circle of Willis. These are the arteries in the head on your left-hand side.
Okay.
And you see the labyrinthine or auditory antenna
Okay.
on the left-hand side. Well, this is the cochlea. You see this organ here, it's called a cochlea, the vestibular apparatus.
That's back of your ear, right?
Right. That's where balance occurs in hearing. There's this kind of a seashell type thing.
Yeah.
That's the cochlea. And little things run around inside the cochlea and hit different hairs and give you balance. And then this other organ over here, I think I have them right. So it doesn't matter. I won't show you which is which. It's been a while since I looked at the anatomy. The other organ, the cochlea, has to do with hearing.
Oh, look at all the blood vessels.
Yeah, but I want you to notice there's just one single blood vessel. You see in the yellow sheath, it's carrying one single blood vessel. It's the labyrinth artery. Comes right.
Oh,
so
yeah.
As that artery gets plugged up, what people develop is they develop Meniere's disease. It's been described for like 300-400 years. Meniere's disease or inner ear problems. It results in tinnitus, vertigo, which is a common name for severe dizziness, and hearing loss. And it occurs in people as they get older, and it occurs in populations that eat the Western diet. just let's get the overall message here. This is just one artery that's being plugged up, which results in hearing loss. You also get arteries to your eyes, which get plugged up, which result in macular degeneration. You get arteries in the brain that get plugged up. You get strokes. Arteries in the heart that get plugged up. You get heart attacks. In the legs, you get intermittent claudication and gangrene. In your penis, you become impotent. So you got all this disease going on throughout the body. All right, I do this for you in part, Heather, because I know you get a lot of calls about the fact that I'm old. And I started studying this 50 years ago. And what I try and share with you is that we've known this for 40 plus years and nobody's doing anything about it. Yet the knowledge is still there and people aren't acting. Anyway, I just took a look at some of the research, that I talked about, that I presented to you, that I give you to look up about Meniere's disease and its relationship to diet. And so I brought for you the articles on Spencer. A guy named Rosen and Spencer back in the late 70s, early 80s. What they did is they traveled around the world and they saw where hearing loss and dizziness and tinnitus were common, and they made a correlation with coronary artery disease. And then when they got back to the United States, they looked at lipid levels and they saw that people had high fats and cholesterol in their blood, had this premature hearing loss. And they actually found populations of people in Africa that eat the McDougall diet, by the way, which have perfectly normal hearing throughout life. I mean, when they're 70 years old, they're hearing as good as when they're 70. And you can read the references in here because I provided them for you. But this was done back in, 1981, 1979. Anyway, it was done back in the 70s and 80s. And
Do you have any newer ones?
I put them out, Mary. There are three that I just printed those out for Heather.
Oh,
But what I wanted to point out to you is I pointed out for you, they're still doing it. They still know that the rich Western diet is plugging the arteries to the inner ear and give people Meniere's disease. And they're treating it. I gave you a couple of modern articles here, published in 2007, low cholesterol diet and anti-lipid therapy, that means statins, in the management of tinnitus and hearing loss in patients with noise-induced hearing loss and lipidemia. That's 2007. That's pretty
well,
long.
here's one from
2021.
2021.
And I gave Heather some more too. Here's one, Lipitor, Lipitor in the management of tinnitus with hyperlipidemias, 2014. There's statin use in hearing loss and type 2 diabetics, 2021. Hey, ladies and gentlemen, I'm not old. I'm just telling you, this has been going on for 4 decades. I gave you the references. You can read them. So why don't you hear about this? Well, why don't you hear that you can prevent such serious problems, which are totally disabling to your life? You develop this constant ringing in your ears or your inability to get up because you're dizzy or you lose your hearing. This interferes with your whole life. You're at a much higher risk of falling and fractures, and it's devastating. Anyway, it's due to what we eat. It doesn't have to occur. It doesn't have to be part of normal aging, is what I'm telling you. And people knew it 42 years ago, Heather. Actually, they started studying it in the 20s and 30s. And you'll find references to that when you look up the articles. Remember, I showed you how to look up articles using hubsci.org, sci-hub.org, sci-hub.org. And the articles that I've listed there, you can get them yourself, likely for free. Just put in the DOI number, the Digital Objective Identifier, the DOI number, put it in this sci-hub.org, and you can read the articles. They're all available for you. Oh, anyway. Okay.
Don't you think people just believe you? They're not going to.
Well, they have to deal with their friends and relatives.
I suppose, yeah.
You see this Dr. McDougall, he's 76 years old. He's been at this a long time, even though he still hears pretty good. Still sees great, too. There are a few other things I do pretty well also. Anyway, I gave you a couple other references that caught my attention this week. One was on hypothyroidism. We talk about low thyroid disease. A lot of you, 30, 40% of you take thyroid, particularly women in their 40s, because you've had your own body attack your thyroid gland. And I tried to explain to you this is due to an autoimmune disease where the body reacts to foreign thyroids. Well, here I gave you an article on vegan diets and hypothyroidism. In other words, people who eat like we do are less likely to have an autoimmune reaction, which destroys
and
your
that's
thyroid.
2013. So, I mean, that's a
Good
new
deal.
article. Yeah.
And then I got into a discussion. Actually, we were talking about diet with this group of professors and students and residents that I'll be talking to tomorrow. And actually, a rheumatologist said, "Well, I didn't know that diet had anything to do with autoimmune diseases or rheumatoid arthritis." She asked if she could see the research. Guess what I did? I sent her the research. Anyway, here's a modern article, The Effect of Anti-Inflammatory Diets. That's our diet. In rheumatoid arthritis, a systemic review and meta-analysis, 2021, just a couple of years ago, folks. The truth don't change. And it just keeps
People have
going.
a hard time believing that.
Well, see, we just got through watching 2/3 of Oppenheimer.
Yeah.
I mean, if you blow up the world, you can do anything, right? I mean, with modern technology, Monsanto inventions, they negate anything basic or human or natural. Oh my goodness. All right. Anyway, that's all I have to say, Heather.
Thank you.
That's
I included all of the studies in the notes for today's video, so you can look those.
Look them up. Look them up. It's and gain a little confidence in what Mary and I, Heather, are trying to tell you. We're not talking out of some dream state. All right. This involves 47 years of research I've done, which involves somewhere between, how many hours a day do you think I spend doing this?
Oh, 3 or 4.
Well, that's
At least 3.
At least 3. How about when I'm writing in addition to
Oh, well,
research?
then you spend 6.
I've been doing this for 47 years. You think I learned something?
I'm talking about right now. Maybe you spend 3 or 4.
Oh yeah, when I write a
Years
book, I do it.
before.
I spend a lot more time.
Yeah.
But look, Heather looks good. Mary looks good. I look pretty good. Something must be working, ladies and gentlemen. I have to believe it. Anyway, when you read Joseph Spencer's studies, what you'll find is when he got back from studying the people in Africa and Europe and so on, he looked at 300 of his patients, and he found that they had hyperlipidemia, hyperlipoproteinemia. In other words, they had a whole bunch of triglycerides and cholesterol and fat in their blood, like we've been talking about. And of course, he related it to Western diet. He had studied 300 patients. He treated them with a lower cholesterol diet. They didn't really know about the McDougall diet back then, and whatever cholesterol-lowering drugs there were. And he got tremendous improvement in these people. Well, what motivated Spencer to do this is he developed vertigo himself and couldn't get off the floor, couldn't practice. So anyway, there's somewhere in there that I read that he got return of high frequency hearing loss returned in about half his patients. Plan on it. You can get better. You don't have to get sicker and more unattractive as you get older. It's the food. I have a question, Heather.
So many.
It's so sad. But you know what I really hope, and I want you to sincerely think about this, folks out there listening tonight. If you know anybody who's involved in a medical school or education of residents or noontime conferences at hospitals that have any interest in diet therapy, you might approach them like this. You know about drug therapy. You know about music therapy. You know about aromatherapy. How about diet therapy? You ever heard of diet therapy? Well, there's this doctor, he's spent 55 years taking care of at least 12,000 people and written through 13 national best-selling books. I bet you young doctors or older doctors missed out on an education about what human beings are supposed to eat. Well, he can help and introduce me to them. I will be there. Believe me, I will be there. Happy to talk to them and in a friendly manner. Sometimes I used to worry about, I've got a blood blister.
I wondered what that black spot was.
I slapped my finger in something, a lid.
I saw that black spot and I thought, what did you do?
I bleed.
Well, no, you popped it. It's like you must have crushed it in a
Let's
drawer.
get back to the students.
Okay, sorry.
All right. But, I really know I've learned over the years and my profession has grown up a lot because they've seen the harm done by the drug companies and the dishonesty. So my colleagues know better. They're just looking for answers. And I've gotten to the point in my life where I don't get defensive about things anymore. No, I don't.
Well, you have to believe they know the stuff, because even the ads, the happy ads you see on TV, if you take the time to listen and look at the bottom, it tells you all the awful things
Can't give you
that could happen
cancer,
to you.
give you TB, tuberculosis.
So it's not like these are miracle drugs that they have terrible side effects.
The price you pay is huge, especially since food's free. Heather.
Okay, are you
Okay.
ready?
Anyway, I'll tell you next week how the rest of my lectures went. If you want to see the lectures, the 5 lectures, 10-hour series I put together for my colleagues on diet therapy, we have it available for you.
Heather's got them on sale. I saw that today.
Oh, you got them on sale, Heather?
Yeah.
Are you giving my books away again?
yeah.
Are on sale for 25% off, and all of our digital books are free. Yes, I give them away for free for Christmas, so for the holidays.
You know what's going to happen, Heather? We're going to educate this mob of people to the point where they rebel. If there's going to be a revolution, don't tell them too much.
I hope
They
so.
might
We
get
need
the
an
idea
army.
that diet has something to do with disease. All right. Anyway, I promised people we'd answer questions tonight.
We've got lots coming in. So let's see. First one from Danny. He wants to know what you think about lion's mane mushroom supplements for lowering blood sugar.
I've never heard of that. I've heard that they help with depression. And mushrooms are amazing.
I don't know about the supplements, but the lion's mane mushroom itself.
We grew them.
Yeah, we grew them. They're great.
Yeah, really.
They're
You
fun to
put
eat.
them in. Is that the ones we put in the cocktail sauce?
Yeah.
Oh, these are mushrooms, and you cut them up, and they remind you of the old days when you used to eat lobster and shrimp.
They almost look. They
Or
almost
lobster and
look like
shrimp. They're almost gone.
cauliflower when they grow. They look like they're white and they're leafy and they look like cauliflower.
Yeah, you take ketchup and Worcestershire, an animal product for your Worcestershire sauce.
No, they have
Well,
vegan Worcestershire sauce.
You know, so I need
Yeah.
vegan. So you take some horseradish, some Worcestershire sauce, and some hot spicy ketchup, and you can dip that in the lion's. I don't know whether it helps with diabetes or anything,
It tastes
but they
good.
sure taste good. And there's the way we bought them is there was somehow to make you more calm and comfortable and confident and have a lot of positive psychological things. You're going to hear a lot more about mushrooms. It's one of those things which I knew more about. It's the world of mushrooms. But, you know, at my age and stage, I'm not going to get into anything like that.
Well, we have our son Craig and his wife Mika. They bought these
I sent one to you, Heather.
long
Logs.
2 long logs, and they have them hanging on by their house, and they're filled with shiitake mushrooms.
Yeah.
And so she's planning on harvesting the shiitake mushrooms out of these logs.
But mushrooms are very, very exciting. And I'm sure you've read about it in the paper. I know people in Oregon have, because we have mushroom therapy, psilocybin therapy in Oregon, which is,
And it's started now too, that people can sign up.
yeah. So, you know, I mean, the psychiatric profession has been criminal in their behavior of taking care of people, regardless of the mushroom issues. They've hurt people with antidepressants, and I mean, they advertise drugs that treat the side effects of the drugs they get from mental illness on TV. Anyway, you know, they're going to go down as one. Well, let's see, we've got oncologists, cardiologists, psychiatrists. Those would be the top 3 I'd name as far as the emperor has no clothes and they're lying to the public.
And this is where I'm going to step in and say, in general, there are
There you go.
cardiologists, oncologists, some wonderful doctors out there.
There are some exceptions, you say, Heather. Not in general. In general, most of them are out trying to pay the bills.
But there are getting to be more and more exceptions, I think,
Yeah.
because people are actually learning about this stuff and listening and believing.
Well, it's not a good way to make money unless you figure out how Heather and Mary and I have done it. And that's to educate people and try and do things that allow us to look in the mirror in the morning. But otherwise, you've got to see patients every 7 minutes, and you've got to ding them for as much as you can for that visit. This is the business of medicine. And the way you end the conversation is you hand a prescription to the patient. We're done. Got your money's worth. Here's your prescription. Oh, but doc, you only told me to eat mashed potatoes. I'm not going to pay for this bill. What was the question, Heather? They want to know if mushrooms, shiitake mushrooms, or lion's mane mushrooms were good for what kind of problem?
Lowering blood sugar.
I don't know that. I wouldn't be surprised. They're no cholesterol, low fat, high fiber, they're different. I think you'd consider them different than the animal and plant kingdom. I need to learn more about mushrooms.
Okay, next question. This is from Jeff. He's 67, 150 pounds, 5'10". He's been following the starch solution for 6 or more months, but he still has high blood pressure, around 150 over 100. He wants to know if he needs drugs or if he's just a stubborn case.
Well, I think first you need to decide what your blood pressure really is. And that would be done by quiet, comfortable home monitoring or a 24-hour monitor, which your doctor can prescribe to see what your blood pressure really is when you're not worried or, you're not afraid of the sphygmomanometer, the blood pressure equipment. So really determine what your blood pressure really is. The studies, and in fact, I talked to you about them last week, show that only diuretics are beneficial in terms of reducing the risk of strokes, not heart attacks. And even though the other classes like calcium channel blockers, beta blockers, angiotensin receptor blockers, ACE inhibitors, you name it, they will lower blood pressure, but they don't reduce your risk of having complications. And the drug that is really beneficial is chlorothalidone, which doctors are starting to prescribe again. They're the kind of diuretic that was used in the 70s and early 80s in the veterans study, which showed that people who had malignant hypertension, like it's 240 over 120 or 30. Not like you have 140 over 100, but they reduce the risk of heart failure and stroke, not heart attack. And people with severe high blood pressure with a diuretic, and that diuretic chlorothalidone. So I think you'd monitor your blood pressure very carefully.
I would probably recommend that he buy a new blood pressure cuff first.
We've had problems with our cuffs, haven't we?
Yeah, because
No.
remember when we had the blood pressure cuffs in the office, we would have to send them back every year and have them recalibrated to make sure they were correct. So, it could just be a bad blood pressure cuff that's giving him a bad reading.
You could always stop at the fire station or at the corner dock in the box. They would probably check your blood pressure for you. But then you also might try a low salt diet. Unfortunately, low sodium diets don't reduce blood pressure much. The reduction, when you decrease the sodium intake from 1,750 milligrams a day, you take that much off, 1,750, which is about a teaspoon of salt. When you take that down to where they're taking in 3,500 milligrams a day of sodium, the reduction in top number is around 3 millimeters of mercury, maybe 6, not much. The reduction in the bottom number is around 0.6 of a millimeter of mercury, hardly anything. So that's why we recommend a little salt on the surface of the food so you like the food, because the overall diet is going to be much more important. But if you go to the extremes of Kempner, I've talked to you about that. You can look up on the website, December 2013 newsletter, and you drop the sodium intake to really severe, you'll drop your blood pressure. And then the last resort is I would think about taking the diuretic chlorothalidone, maybe 5 milligrams a day. They only make them in 10s, by the way. But my patients are so healthy, they only need to take 5. And that's probably strong enough for most, 5 or 10 milligrams.
Well, I still think it's really important to wait. For myself, when I had my blood pressure taken, and it was recently, and I was nervous, and it turned out to be 136 over 84. And as I relaxed about an hour later, it was my usual blood pressure of 108 over 65.
Well,
so it was just sitting there and relaxing and not being nervous. It makes a huge difference.
Well, all recommendations, whether the National Health Service in Britain or the American Medical Association or the Cochrane collaboration. They all talk about sustained over months, as you said,
Yeah.
sustained high blood pressure. And they talk about not treating. This is even the American Medical Association. They talk about not treating, say you're age 60, unless your blood pressure is 150 over 90 or greater. Cochrane says they don't see any benefit from drugs unless the blood pressure is, say, 160, maybe to 150 over 90 to 100. And the National Health Service, since 2004, has not recommended the treatment of British citizens for high blood pressure and letting their blood pressure sustained for months at 160 over 100 millimeters of mercury. And that's the National Health Service.
Well, you know what the problem is? I think people worry that if their blood pressure is high for one day, their blood vessels are going to explode.
In the lecture on high blood pressure, which you can see on YouTube, look up McDougall and hypertension, you'll see they've measured the blood pressure in barbell lifters, weightlifters, and they'll measure pressures of 380 over 300 or something like that, or 480 over 350 when they're lifting these barbells, and not a single vessel breaks. And in cadaver studies, there's one study that I talked to you about in this lecture, which you'll want to look up on high blood pressure. It's on YouTube, it's free. In one study, they took 10 cadaver arteries from the brain of people who died, and they tied off one end of the artery, and they connected the other end to a pump. And they had to pump up the pressure in the artery to 750 millimeters of mercury, 1,750 millimeters of mercury before any vessels broke. Healthy vessels don't break. The vessels get sick by being infiltrated with cholesterol and fat and lack of plant parts. And they become diseased trying to grow in this mud and sand and rocks that you feed it every day at the dinner table. Anyway, start putting good food in the body. Watch what happens. Be smart.
Great, thank you.
And, maybe we have some new listeners, Heather. What we recommend is a diet that 99.99999% of people who walk this earth have consumed. This is a starch-based diet with fruits and vegetables, minimal or no animal products. You don't need to eat any animals. You're an animal. You make all the stuff you need. And no extra added oils. It's a diet of starch, like corn was a traditional food of people in Mexico and Central America, potatoes in South America. The breadbasket of the world we talk about all the time, that's bread. And Asians, rice. There have been thousands of starches that people have adopted over. Good grief, I could take you back 108,000 years to Mozambique and showed you that people in Africa ate starch. 108,000 years.
Anything else? I mean, how often did you catch an animal?
Yeah, really, or get it back without refrigeration to your women. Kind of interesting. I'll give a side note here that Heather won't particularly like. But our closest relatives, the chimpanzee, and various monkeys, of course. And the males will go out and they will catch a rodent. And they'll bring the rodent back, not for nutrition, but for sex. As a reward for catching a little animal, the females in that population reward the male.
Do they eat the rat, or they just reward the male?
Well, they're real happy about it. I don't know whether they eat it or not. Okay. But it has nothing to do with nutrition. It has everything to do with sex.
Yeah.
Anyway, do you think we do that in our society? Bringing home the bacons. Bringing home the bacon. I think bringing home the bacon probably hits it on the nose, doesn't it? All right. It's food.
I know, enough.
Okay. Let's see. Lots of great questions coming in. This is from KS. Can you give a brief opinion about the book Wheat Belly and the information it contains?
Yeah. Right. I wrote, I wrote something called The Smoke and Mirrors of Wheat Belly and Grain Brain. Wheat Belly was done by, we debated him. Remember, we debated him in Latin.
Yeah. Well, I don't remember his name right now. Grain.
They're keto diets. They describe both of them as the bliss of ketosis. That's what I think of. They're lying. They're hurting people. Let's see. Grain Brain was done by a guy that I did an interview with. Perlmutter, yeah. Perlmutter. And the Wheat Belly was that guy who's fat. He was
William
obese.
Davis.
Who?
William Davis.
William
Oh,
Davis.
yeah. Thanks.
Yeah. No, it wasn't William Davis that we debated, but anyway, it doesn't matter. These people recommend you go on a keto diet. So wake up. All studies on low carb diets, the keto diets, show you have an increased risk of dying and dying of heart disease. And weight loss is temporary at best. And through a means known as ketosis, where they make you sick.
I think I'm starting to read more articles about the dangers of keto and paleo diets. It seems like it's more in the news that in a negative way than it used to be.
I sure hope so. Well, they've got Ozempic to pick on.
That's true.
We don't have to rely on these make yourself sick, kill the animal, low carb diets that we've been pushing since, for 100 years. Used to be the beer drinkers diet it started out with, and then Atkins picked it up in the 70s. You have Barry Sears. I was thinking of Barry Sears.
Oh,
Remember
okay.
him? We debated him 3 times across the country. That was an interesting time, I'll tell you. Anyway, I wish I had the recordings. You'd have enjoyed them. When I made Barry Sears admit on stage that he didn't even follow his own diet, he couldn't, and showed him the data right out in front of an audience, 1,000 people. The guy stood there and lied to the public. And I showed him the math. Math don't lie. He doesn't follow his diet. Anyway.
Okay, next question. This is from Shelley. She's been treating her RA for 8 years. Let's see, she was on biologics. She's off all drugs. She's on the elimination diet and is eating between 10 and 6 every day. Right now, she can only tolerate sweet potatoes, rice, and squash, and is wondering if that's going to change, if her diet will be able to be more varied.
It may, but at least she has someplace to go. These drugs are so toxic in terms of destroying your immune system. That's how they work. They suppress the immune system, like steroids do that. They're so toxic, so expensive. They cost like 10, 20, 30, 40,000 bucks for a year of medication. And, if I was facing that, the expense, the toxicity, the continued progression of the disease, I would look for anything reasonable to accept. And the fact that she's learned that she does well on sweet potatoes and, a few other, she'd just be lucky, feel grateful she found a corner in town where she wasn't going to die. Okay. Now the question is, there's no limit on how much you eat. But you consider this. First of all, most people throughout human history have lived on a single starch with a few vegetables, which were in season, a few fruits. So monotonous diets are typical of human eating. You think about the diet of Asians, it's rice. How often rice? Oh, rice for breakfast, lunch, and dinner. Oh, how did the Chinese say good morning? They say, have you had your rice today? So the idea that you only have one starch to eat doesn't cause me to shed a tear. I just think you're darn lucky. Now, in answer to your question, the elimination diet teaches you how to add foods back. So once you find this corner in town where you can feel good, your arthritis is great, you don't have to be threatened by these drugs and doctors, then start adding back to your diet. And you must add a food back every 4 days. See if you have a reaction. If you do, you eliminate it. If you don't,
it has to be cooked.
And it has to be cooked. All the food's cooked because it denatures the proteins and makes them less allergic. Then you can liberalize it. You'd be amazed at how much more liberal you can become. But if you couldn't, I don't feel sorry for you. I'm happy for you. And by the way, I just gave you another article on rheumatoid arthritis and a similar dietary approach, DARS. You can read it. It's published in 2021. It's true. It's maybe old. We may have discovered it when Dr. McDougall was in medical school. That's the thing. And I tried to tell you this is, I've been at this for 55 years. I started in 1968. So this all happened in my lifetime. You know, they didn't treat blood pressure with medication before 1959. High blood pressure was considered a normal malady. It was a part of life. It wasn't a disease before 1959.
Well, before they started inventing drugs for it.
Then they developed the diuretics. Yeah, all the stuff on bypass surgery was during my time. The failure of breast cancer treatments and amputations is in my time.
I remember seeing the first heart pump.
In the operating room?
Yeah.
You were there?
Yeah.
You're a nurse. You get to see it.
I remember seeing it sitting in the corner of this big white thing.
An operating room, a heart-lung machine.
Yeah.
The brain killer.
Oh.
Anyway, there's a better option for you. And again, repeating myself before we go on to more questions, is just give us a try first. There are lots of other people out there that want to drug you and manage you and device you, and give us like a week.
2 weeks.
2 weeks. Okay.
Yeah.
Assuming you don't.
Like our 12-day program.
Yeah, like our 12 days.
12 days.
Give us 12 days. Give us 12 days and it will let you get your health back. Because we can't do it. You have to do it. Okay, Heather.
Thank you. Okay, next question. This is from Carlos. He's wanting you to talk about plantar fasciitis and what to do about it.
Plantar fasciitis is on the bottom of your feet.
Yeah, he's looking into extracorporeal shockwave therapy. Wants to know your opinion.
I have none. Plantar fasciitis is where at the sole of your foot, the tendons become inflamed. It's an autoimmune disease. It's where the body attacks the tendons and causes chronic inflammation. They eventually end up as scar tissue. I have every reason to believe it's the food that got you into trouble. Well, why doesn't everybody who eats the American diet have plantar fasciitis? Well, why doesn't everybody who eats the American diet have a heart attack or get rheumatoid arthritis? It has to do with bad luck, the wrath of God, your genetic makeup, and what you choose at the dinner table. Sister Nancy, she may choose a lot of oily, greasy vegetarian foods. You may be heavy into meat. You're the same family sitting at the dinner table. And the other things that have happened to you in life too, not just, I can't think of what they are, but not just heredity and food. There must be some other things. Bad luck. I'm sorry, I don't know about extracorporeal. Heather, extracorporeal means outside of the body, blood. They take blood outside. Possibly he's doing something that we know who does this kind of therapy.
Oh yeah, we do.
We know a doctor really well. You know him too, Heather, who takes either saline or takes red blood cells and processes them and then injects them back into tissue. I know what you're talking about now. Okay, and they inject it directly into the area where you have the inflammation, the arthritis, the scars, etc. I wish I could remember the name of it. Doesn't matter. We just talked about it. He's very close to me. I know him really well. Heather knows who he is too. Yeah, but he does this all day long. He believes in it. I ask him for the research. I know. I ask him for the research that supports it, and he's been hesitant at giving it to me. But
those there isn't any.
Possibly not. But he makes a ton of money. God, does he make money every time he injects somebody? Whoa. If you're thinking about getting into a business, this is a good one. Take people's red blood cells out, process them by spinning them around. I think they do that. And then they re-inject the product back into the body through a syringe. Good business. Does it work? I don't know. I really don't. I'd like it to work because I want my close friend to be driving a Tesla.
Okay, thank you.
Really? Don't you think he should be doing this as well as somebody who does heart surgery? I do.
If he's doing a good thing, sure. Okay, this next question is from Lori. She is watching from Mexico. She would like to know if a person has had a heart attack, eats the McDougall way, feels pretty good, but their blood pressure drops to 96/50. Should they be worried?
As long as they're not on drugs. If you're on drugs and blood pressure drugs or any drug that lowers your blood pressure, you increase your risk of stroke and heart attack. If you lower your blood pressure, only on drugs now, and I assume you're not on drugs, if you lower your blood pressure below 140 over 90 millimeters of mercury, then you do something, you decrease the perfusion pressure, in other words, the flow of blood to your brain and your heart, by poisoning various parts of the system with these blood pressure drugs. So not enough blood goes to the heart, not enough blood goes to the brain. Yes, you have a dramatic 4 to 6 times the increased risk of heart attacks and strokes if you overtreat blood pressure with pills. Now, if you're not taking pills or any other medication that lowers blood pressure, I mean, there are a lot of medicines people take that aren't called blood pressure pills, but they do lower blood pressure by similar mechanisms, or it doesn't matter what they lower them by. Then it's great, it's fine. If you want to rely on a sign, something that is more reliable as to whether you're going to have another heart attack, it's your blood cholesterol. Blood cholesterol is the best predictor as to what your future is going to be. I start out with a heart lecture, which I'm going to give to the medical students, residents, and doctors at this very famous hospital this week. Starts out by talking about the work of William Clifford Roberts, who was a personal friend of mine. He was the head of the National Institute of Health's pathology division for the years that I know him. He wrote an article, Are There 10 Risk Factors or Just One? And it's in the beginning of my heart lecture. In case any of you have that heart lecture, you can look up the reference. And what he says is that if your cholesterol is below 150, then your age doesn't count. Your gender doesn't count. Whether you're diabetic doesn't count. Whether you have high blood pressure doesn't count. It's just that key factor of 150. Do I believe that's absolutely true? No, I don't. Do I think it's of some predicted and worthwhile reliability? Yeah, I do. Because your cholesterol is going to reflect how you eat and how your body handles all that animal food. Cholesterol is only present in animal products. So it's a good sign as to what you're eating.
Thank you. Okay, next question. This is from Carol. She has terrible diarrhea that keeps her up at night. The doctor tells her to take Imodium so she can sleep, but she read that it paralyzes the intestines, so she's afraid to use that. Do you have any recommendations?
Yeah, I can fix this one easy. Maybe not, but I'll try. Imodium is an opioid. And opioids, like codeine and morphine and the different opioids, they paralyze your bowel and cause terrible constipation, which, by the way, we have a new drug out to treat opioid-dependent people who have chronic constipation. Okay.
Oh, we do?
Yeah. Anyway, the thing you have to think about is what causes the diarrhea. And I assume, if not, I assume you will, have your stools checked for parasites, amoeba, any type of chronic infection that could give you chronic diarrhea. Let's see. I can't think of too many, but there are, Shigella and amoeba and, different types of bacteria and parasites, but they're usually pretty dramatic and often self-limited. So what could we do to deal with chronic diarrhea? Most of the chronic diarrhea that I see, which is easily fixed, is fixed by a low-fat diet. And it was described by Dan Dreesen. You can look it up. Published in Gut, G-U-T, is the name of the journal, in the 1970s. About 1973 is the paper I'm thinking about. And Dreesen, he took people with chronic diarrhea that have like 20, 30 watery stools a day. And he put them on a low-fat diet, and they reduced within 48 to 72 hours. 48 to 72 hours, you can do this. It reduced down to 2 or 3 form stools a day. What was causing the chronic diarrhea was bile acids that are made in the liver to digest fat. So when you eat a high-fat diet, sometimes you'll make too many bile acids. That can cause the diarrhea. If you have missing your gallbladder, then you have no place to store the bile acids between meals. And so you have a chronic drip of bile acids into your bowel, which irritate the large intestine. Half the people who have their gallbladder out have bowel problems like diarrhea. So how do you treat this? You go on a low-fat, Crohn's disease is another one. And you could have subclinical Crohn's. and a malabsorption of bile acids in the last part of the small intestine. You don't know this, but your doctor might look into it. But even before that, after you do the basic tests, stool tests, if you just go on Andreessen's approach, low-fat diet for 72 hours, you could solve your problem. I'm talking about fat. I'm talking about olive oil, canola oil, safflower oil, pig fat, cow fat, you name it fat. You get it out of your diet because bile acids digest fat. And if you don't eat fat, you don't make bile acids. Bile acids irritate your large intestine, cause you watery diarrhea, which goes away in 48 to 72 hours, according to Andreessen. And by the way, it happens with my patients too. People get upset with me. They used to get upset with me. We talk about, I'm overweight, doc. I got on these pills, doc. And by the way, I haven't been able to go to work for 3 years because of the chronic diarrhea. And I would come back and I would say, well, we'll fix the weight, we'll fix the cause. Oh, we'll take care of that diarrhea problem in a day or two. And they think I was joking with them. I was making fun of them. I said, I'm not making fun of you. You'll be gone in a day or two with the diet. But anyways, I guess the bowels are a very private and sensitive area. You got to be careful how you talk about them.
So what if you have eliminated all fat from the diet and you still have diarrhea? Is there anything you can take?
Yes. Thank you, Heather. Heather is heard enough that she deserved it. At least board certification in family practice.
Oh, really?
Yeah, there's a drug. It's called a bile acid sequestering agent. Your doctor has prescribing them most of his or her career, or should have been. Questran, Colestid are two of them, and they grab bile acids in your intestine and stops the diarrhea. One of the side effects of bile acid sequestering agents, Colestid and Questran, are chronic constipation. So yes, you do that. That would be the way. Put a little of that into your program. And I have people who, we solve their diarrhea with food, solely with food. And then they say, well, I'm going to a Thanksgiving dinner and I don't want to be embarrassed, or I got to ride an airplane. I don't want to have to get up and, disturb everybody. So is there anything I can do before I go to this party where I know I won't be able to eat? By the way, the diarrhea happens within minutes. So plan on a really exciting party. And they want to know if there's something they can do. Well, they can take a Questran or Colestid before they participate in the
Are those prescription or?
Yeah, they are prescription, and they come in powders and pills. Get the pills; it's more convenient. Colestid, Questran, your doctor knows. It lowers cholesterol too. That's why it was originally prescribed back in the
Oh yeah, I
50s.
remember. Yeah, when we first started, that was all that was available.
That's what Spencer used in rosin, treating his hearing loss problems back in the early 80s that we started talking about, is they used a niacin and Questran, cholesterol-lowering drugs. That's all they had. They didn't know about. They didn't know how strict. They were worried, back then they were worried if you ate a vegan diet, somehow you'd end up as a puddle on the street, fall apart. They didn't understand what human beings eat. They thought human beings ate like cats and dogs, but they don't.
Okay, thank you. Next question. What is your opinion? This is coming from a couple of different people. Hanging Out with Kim first wrote about it. What do you think about the RSV vaccine?
I don't know. Well, I tell you, I'm getting pretty good at I don't know. So I'm looking at it, ladies and gentlemen, because Mary and I, I am a believer in vaccinations. All right. Why? Because they work.
Some vaccines.
Some vaccinations.
Most.
The ones that work, I believe in. All my children, grandchildren are fully immunized. But there are certain vaccines that don't work. The best example is the flu. It's because the flu virus changes every year. And they make the vaccine for last year's viruses. It's turning out that the COVID virus is just as variable. It mutates so rapidly. There's so frequent genetic drift that they'll make a vaccine against this particular COVID variant, COVID, COVID variant. Then in the next newspaper you pick up, they got another variant.
At least they're talking about it. They realize that it's changing, and they're trying to quickly make new vaccines to catch up with the new variant that's coming out, but I don't think they do. But
my guess, Mary, is what they have to do is they have to figure out a component of this coronavirus, it's a cold virus,
yeah,
that doesn't vary. There are some parts of the virus that change rapidly, mutate, and there are some parts that don't. So they have to make an antibody, a vaccine, that attacks those non-changing segments of the virus. Smallpox, chickenpox, measles, hepatitis, they're all stable viruses. We've been fully vaccinated against those particular problems. HPV, HPV. No, the kids, we're trying to get them to take. But we've had shingles. We just got our pneumonia. Hey, why throw the baby out with the wash water? Excuse me, what works you ought to use? Clean air, clean water, clean food, vaccinations, and sanitation, and stuff like that.
And he'll have an answer for you on RSV soon because he's been.
I'm looking at it.
He's been researching it.
I've even asked my viral experts to let me know whether this is going to be a virus that's a big enough problem, number one, and one that has an effective vaccine. I'll tell you what really works, and we know this. We've learned it from both sides of the table, is social distancing. You get around sick people, you're going to get sick. Plan on it. We were free of any illnesses for 3 years. And then we started seeing the family again. The family goes to school. Kids catch viruses. Guess what happens to grandma and grandpa? And I don't know whether we're going to go back to those more stoic practices or not. That was tough. Really hard on everybody. But dying's pretty tough too.
Okay, well, we look forward to hearing what you find out about RSV.
I'm working on it. I've spent a little time where it takes a while sometimes, Heather. They come out with the vaccines and then, they see that they're getting some type of response. Maybe the virus loads are decreased or something. But what you want to know is, were people able to miss work less frequently? Was there a higher absentee rate in, say, schools or businesses between those who got the vaccine and those who didn't? So that's the kind of research we need, is clinical research that shows the practical implication when you apply this to the population, not some test in some laboratory. Those give you, too often they give you false leads as to effectiveness. Hey, did I tell you I wrote another letter? I may have told you this last week, so I won't spend a lot of time on Lequimbi, and they got a new drug out for Alzheimer's. Didn't benefit at all. They just came out in the New England Journal of Medicine last week, and I sent them another letter to the editor. Said, look, guys, why don't you study deferoxamine, which deals with the cause of Alzheimer's? No money in it. They're not gonna write back and tell me you don't make any money on deferoxamine. We make like $26,000 and $56,000 a year on the drug for a single patient that doesn't work, that gives them a 20% chance of serious brain damage from taking the drug. Deferoxamine has no side effects except for the poke. And it clears the body of aluminum. Let's see if the New England Journal of Medicine will publish my article. JAMA didn't. I sent them to them 3 months ago. They decided not to publish it. Well,
Don't hold your breath.
The public deserves a proper evaluation of deferoxamine, which cut clinical deterioration in Alzheimer's patients in half. None of these new drugs come even close to that, with no side effects. Look it up. It's on Amazon. Deferoxamine. Look up, I think just Google and look up deferoxamine. You'll find it. DEFER, like so. Spell it, Mary. DEFER. Sometimes they spell desferoxamine with an S. Deferoxamine.
I'll share a link in the chat.
Yeah, well, I keep trying. But there's too much money. It just plain and simple. It's just too much money involved. Your life is really pretty irrelevant to the equation.
Okay, let's see. Next question. This is from Cardinalis. How does cholesterol and LDL leave the body on the McDougall program?
Don't eat it, it goes away. I mean, probably what she's asking is how the plaques go away. Well, there's this is a physics and chemistry and so on. There's an equilibrium established between the plaque and the tissues and the blood. So if you lower the amount of cholesterol in the blood, the equilibrium is changed in favor of of cholesterol coming out of the tissues into the blood, excreted from the liver. The liver takes the cholesterol out and it turns it into bile acids. Cholesterol is a precursor of bile acids, and then you poop it out. It's gone. That's how you do it. Cholesterol is a kind of a hard thing. It's kind of a solid, dense part of a particle called a lipoprotein. And these lipoproteins run around with a glob of fat and some protein and a central nugget of cholesterol. And when you stop eating the food, you lower your triglycerides rapidly. And you lower your cholesterol. Well, in 7 days, we dropped cholesterol 22 points, 22 milligrams per deciliter in 7 days. And we're talking about starting with a cholesterol, say, around 220. So,
That's pretty good.
Equilibrium comes out. Hey, look, you've got to take some suppositions if you're going to take care of yourself this way. You have to assume that you are a healthy person. You've got a good body that's trying to stay alive. It's just that you don't understand the right set of rules. And if you apply the right set of rules, then the body does what it's supposed to do. It's not supposed to be sick. But it's being burdened by this constant indulgence of food intended for not a cat, not a dog. You wouldn't feed your dog and cat ice cream cones and cheesecakes. You wouldn't do that. Maybe it's for your kids. Maybe it's for you. Oh, come on, folks. You've got a good body. Really. Just stop punishing it. It'll respond like in a few hours. You'll feel better in a few hours. Certainly give me a week.
Thank you. Next question. This is from Raina. She recently started the program. She's wanting to know how to get rid of vertical nail ridges and very thin hair. Has hypothyroidism and iron deficiency anemia.
Well, you got to correct the hyperthyroidism. That's what causes thin hair. And the nail ridges, I've never been able to figure out what causes nail ridges. There are some serious diseases and serious malnutrition that causes ridges in the nails, but not in the general population. But as far as brittle, thin hair, this is a characteristic of hyperthyroidism, along with profound weakness. So get it corrected. That's what you need to do. But it's not due to protein deficiency, as I know a lot of people worry about. Oh, I'm not getting enough protein. My hair is going to get brittle and thin. I still got hair.
So do I.
Look at this. I had to grow this to make sure you knew I could grow hair. So anyway, it's not true. You got plenty of protein. Horses have hair. German shepherds have, they're meat eaters.
They're meat eaters, yeah.
Horses have, let's go back to horses. Lambs have hair. Sheep wool. Yeah. They got hair. They can grow hair on grass. Well, they'll grow hair.
Goats.
Okay. We could go on forever on this game.
Yeah.
I know. The industry has done such a great job of brainwashing us that we don't stand hardly a chance unless we open our eyes. And fortunately, the truth is there. And we try and provide for you through all our programs, our 12-day telemedicine program, through our 5 o'clock Sunday Pacific time meetings that we have with you every Sunday night. We just try and give you the evidence, and the truth is the truth. You can look at it, believe it. You can ask my colleagues whether it's true or not, and most of the time they'll say if they're honest, they say they have no idea. We didn't deal with that subject in medical school. You didn't deal with what people eat in medical school? No, they didn't mention it. They didn't think it was important, but they taught us a lot about drugs, how to eat drugs. Anyway, we'll meet next.
We laugh, but it's true. I can't tell you how many medical students have told me that same thing.
Yeah.
That's why they're silent, Dad. I wanted to say the reason why they're silent is because they've never heard this before. But you open their eyes and you get them to start asking questions. And I know if you spoke to them again, they'd have a lot of questions. It's just hearing it the
Oh,
first time. It's
Thanks, Heather. I hope I get invited back. There's
Well, it's got to be a shock to hear it the first time and think, why didn't somebody tell me this? If it's true. you
well,
know?
especially if you have your whole practice, all of your income based upon doing things that are wrong, like heart surgery or amputations for breast cancer. You folks, I had to tell you that there's a special place in hell for you for lying to the public. Did I say that? Okay. What?
Enough.
Enough. Close this session, Heather.
all right. Well, that was fun. Now our hour's up. That went by so fast. Lots of great questions. Thank you all for tuning in.
See you next Sunday, 5
Yeah,
o'clock.
we'll be busy this week, and we'll see you all next Sunday at 5 p.m. Pacific. Thank you all.
I'll
for
be just
tuning
as outrageous as I was this time, unless
Oh.
Mary and Heather keep in mind. I'll try.
in. Interesting.